Health insurance premiums continue to increase at an unsustainable rate, as you all know. This is not a challenge unique to Massachusetts, and it has nothing to do with our 2006 healthcare reform. Premiums increased across the nation on average 130% over the last decade. Mississippi, a state that has no public commitment to universal care, has seen premiums increase 113% in the same period. The point is that across the nation, just like across the Commonwealth, working families, small businesses, and governments alike are being squeezed every year by ever higher premiums. If the first phase of reform was about reaching the 400,000 or more uninsured, this phase is about relief for all 6.5 million Massachusetts residents. The good news is that there's an emerging consensus about solutions. By most accounts, higher quality care, meaning well-integrated, whole-person care, equates to lower cost. Instead of the fragmented fee-for-service system we have today, we ought to pay for integrated care. Paying for that kind of care will encourage different kinds of behaviors in the delivery of care with the added benefit of restraining costs. We believe increases can and should be limited to about the rate of GDP growth. Secretary Bigby will cover this in more detail in her testimony. The bill I filed will hasten the move to this integrated, high-quality care and lower costs to consumers. The bill proposes specifically, number one, to provide a common set of standards and benchmarks for the formation of integrated care organizations commonly known as ACOs and alternative payment methodologies. Number two, to clarify the authority of the Commissioner of Insurance to consider a wider array of factors when considering whether to disapprove excessive premium increases, including the underlying provider rates and how they compare to medical cost inflation and GDP growth. Number three, to organize an advisory council of stakeholders and consumer voices to monitor the progress of this next stage of reform and other experiments in cost control. And number four, to modernize the system of resolving claims of medical malpractice in favor of an apology and prompt resolution to de-emphasize so-called defensive medicine. Many